mistake. I'm really sorry. So like I said, these are the common social media platforms that we all use. Other than that, there are blogs, there are podcasts, there are videos, which all of us use. They are a necessary evil, need of the times, to some extent inevitable, a double-edged sword also, and we need to have certain precautions when we use social media. Why we think that social media is so important for doctors? See, in 2012 itself, Facebook had 1 billion users in the world, and the usage by doctors has risen dramatically, and a lot of students are also using social media. And not just us, our patients also are using social media very often, especially it has been seen worldwide that those with chronic conditions, they are seeking out social media either to get health information, to connect with their doctors, to connect with other patients with the same conditions, similar conditions, and to form support groups. So, as doctors, social media is changing the way that medicine is practiced because it has the power to engage people in public health also. This is one of the positive fallouts of social media, that we can make governments change their public health policies, and we can engage everyone in positive and powerful discussions. It also helps us establish professional networks and facilitate patients' access to information about health and services. So it may go on to become a key resource for doctors worldwide in the coming times. It enhances, we can enhance self-learning. Like we are doing now, we communicate with peers and co-workers. We are able to communicate with our patients. We can get into public health awareness campaigns. Disaster management is a very important part of social media because disasters where we know there is medical problems also. In that, social media comes in. And then, of course, for research recruitment, we can get our patient, we can get patient database through social media. As far as conferences and CMEs are concerned, for example, this general hospital, we were thinking of starting a webinar. We were thinking of starting a discussion club for a long time. Finally, in COVID times, Dr. Anju made this possible through a webinar platform. So this is how CMEs, conferences have all now, we are all using social media platforms, video conferencing, and also streaming these live on YouTube. So this is how we are all now utilizing social media for enhancing our learning and consolidating our knowledge. This is something very interesting because so many journals are published every day nowadays. It is probably not easy for anyone to keep up with their, what their interest in is in their field. And however, a lot of journals will open initially a 1 to 2 hour window for initial discussion and throw it open to a lot of people. So you get to read a lot of very important and interesting yet to be published data also in a certain window. And at the same time, people are holding remote journal clubs and they can engage in discussion with other healthcare workers who may have similar experience, but they are in other geographical locations. So there is a certain addictive appeal in having to the power to consult so much resource so readily in such a structured fashion. Like when you're going through paper journals, it's more difficult. Library jao, journal issue karao, and so on and so forth. Hello, बाद में डॉक्टर सकीना के ले लेंगे. So, but here, you have everything at the click of a button. It's in your laptop, it's in your computer. You can go back to it also and read again whenever you need to. So, of course, not all that you read online has been peer reviewed as robustly as an actual published journal. So we have to be aware of that. And then there can be some gray information, there can be biases of others which creep in because the peer review is not that well established in some journals which are only there online. So we have to be aware of this. Likewise for appraisals and record keepings, because we all now attend CMEs online, there are some portals which also allow you to keep your record of your own CMEs, even print out your certificates so that you can utilize them later when you are going for your own appraisal in your institute or you are going for a new job. You have that handy, that I have learned this. These are the CMEs I attended online, and this is the record. These are the certificates I got. Thank you. So likewise, you can use social media for your unpublished ideas, upcoming trial ideas, for recruitment to studies, for discussing safety ideas when you are looking for ethical permission and all. So it can open doors to new practices. It may help promote patient safety and improving the quality of healthcare practices and even research ideas. Now, when you're communicating with peers and co-workers, you can connect via, like we have in GH or in our webinar group, you can do that via a WhatsApp group. There can be Facebook groups. There can be also more professional portals like ResearchGate, LinkedIn, etc. So on all these, you can discuss papers and resources. And we all know that this has a huge penetrance. Whatever we place on a social media platform will reach thousands of people within no time. And people are able to pass, comment, discuss, offer their opinion on these topics. So the platform is just huge. There are some doctor-specific networks such as Quantia, MD, Sermo, Doximity, iMed Exchange, which are not for lay people. Those are only for doctors. In India itself, we have M3 India. There is Librate. There are many more such. I'm sure that different specialties have their own also. So these are sort of online gathering places where doctors learn from each other, and you can even do coordinate, care team interactions. For example, for a patient who has cancer, you could have gynecologists, you can have radiotherapists, you can have palliative care nurses, you can have dietitians and psychologists. So basically, these are very difficult to arrange in real time, but very much easier to arrange online over social media. So you increase the transfer of ideas, practices, and you can even make career strategies over social media. And like I said, when you are improving, when you want to improve communication with patients, you can have WhatsApp groups, you can have Google circles, you can have many such groups over various social media platforms to improve your interaction within your own multi-specialities and along with the patients. And these can be done anywhere. They can be done on smartphones, tablets, laptops, just anywhere. You need to have a good Wi-Fi connection. So WhatsApp nowadays is a great telemedicine device and platform, which is free of cost, literally, almost no cost except for a Wi-Fi connection. Patient uploads his reports and you see them at the click of a button. It is very free, it is easily accessible and usable, but whether we need any regulation in this, we'll come to that. So if used judiciously, all these telemedicine and communication platforms over social media, they break down geographical barriers. And especially when your patient is remote, your colleagues are remote, they can encourage patients to pursue expert clinical examination at a higher center, such as say SGPGI in our case, and at hardly any added cost. So, as a highly social species, we humans are affected by our nearby friends, also distant friends, and also by friends. And when we engage in social networking, then we influence others and we are influenced by them. So we have already established that social media is a necessary evil. It can help contribute very positively to public health issues such as obesity, smoking cessation, eating behavior, sexual risk behaviors, etc. For example, Facebook recently had opened up an organ donation page, and that led to a 23-fold surge in donor pledges within 1 week of their opening the organ donation page. So this is the positive fallout of social media in medicine. We can also have status updates, for example, weather advisories. We can talk about 5K runs. We can, as doctors, we can help enroll our patients into these. For example, me and Rama can help enroll all our obese patients in the runs that are advertised on social media so that they start on a positive health program. We can also mobilize the local community around this, that these are the walking paths. This is how you can avoid areas with bad air quality. We can also improve funding to fight obesity, etc., etc. For health research, social media is very, very important, especially when we are talking about, reaching young adults or those populations with, when we are talking about rare health conditions, populations which are difficult to reach. So, or example, young adults, as in polycystic ovary disease in gynae, because it can have, if you put your trial idea over social media, then it reaches the key population within minutes, and you can ask for people to enroll. However, as doctors or healthcare workers, it becomes extremely important to protect the confidentiality then of the people who are enrolling. While we put our idea over social media, we ask them to get back to us personally, either as a on a WhatsApp group number we have given them, or our some other number or email that we have given them, so that then the patient's details are not out on social media. This we have to take care of. So traditional medicine versus social media in medicine. Traditional medicine values privacy, confidentiality, one on one, face to face interaction, and formal conduct. But social media values sharing, openness, connectivity, transparency, and informality. So rather than being seen as a substitute, social media has to complement those interactions because it has a very powerful networking effect. Now, institutions which have positively used social media, I will not talk about all these. I will just talk about SGPGI and Ministry of Health and Family Welfare. Ministry of Health and Family Welfare has reached out to everyone via WhatsApp, via Twitter, and via Facebook. We can get onto any of these platforms, and MOHFW keeps putting updates about COVID-19 on all these. SGPGI likewise, let's skip these. We won't have time for all these. SGPGI likewise, this even our webinars, they go under the NRC NMCN portal. They go onto YouTube and they are available for everyone to get back to these and see them on their own time. For example, I had missed their CGR on various vaccines which Professor Dr. Anita Agarwal had hosted. Dr. Gagandeep Kang had also participated in this. This is available on YouTube. The SGPGI Research Day is available on YouTube along with the talks by all the three invited speakers. And I also saw, as I'm just giving examples, a very interesting talk by Dr. Moinab Sen, one of our very young and dynamic faculties, which was about treatment prescription, the ways of improving treatment prescription, the rights and the wrongs, the do's and the don'ts. So these are all available to us at all times, and we can get back in our own time and access these. Likewise, Fortis Hospital was running a year-long webinar series on mental health. We have all come across M3 India on Facebook. They are running a very good series on various medical topics, which you can read in your own time. eMedi News India, all of us know, are also running very interesting topics, which you can get back to and read whenever you like in your own time. So social media is a brave new world, but it has inherent platform pitfalls like everything else. So coming to doctors or healthcare workers and their public profiles on social media, we have to maintain very clear professional boundaries. In India, these boundaries are somewhat blurred, but even then we have to be careful about what we put on social media because our patients may be accessing our networks, our profiles. So we have to be clear that what we put there has to have a certain decorum. So doctors are actually advised to create online profiles, which are their professional pages, and then patients become their friends or fans. Otherwise, if they put on unfiltered stuff on their Facebook pages, then it may become problematic for them now or later, because Something that we all need to remember is the destiny of our data. Whatever goes on a social media platform is then there online forever. We may delete it, but someone else may have downloaded and may be using it. So we must be sure about what we put online, whether it is our pictures or our opinion or our knowledge. It must be put in such a manner that we are sure that that's something positive that we have put there. We must not engage in any behavior which is offensive or which is controversial, because we may get into problems later on. So, offensive behavior is an absolute no no when we are on social media. Students who are on social media, they are of course entitled to have an active social life. But what is considered as youthful exuberance today may later in their careers become problematic. Employees, all those who are college trainee, this is very important for all those, especially who are applying for jobs, for scholarships, for further studies, because recruiters nowadays they check people's social media. So they people may get into trouble because of some pictures or some opinions that they had shared on social media. I am talking only about medical students. I'm not talking about anyone else right now. So we have to be conscious of our online image. In fact, if someone is looking for a college education abroad or a fellowship or a scholarship, then or recruitment, then it will be better that the pictures they share on social media should be professional looking, and they can put information regarding their extracurricular activities, voluntary work, sports, etc. There are actually real life examples of when people have suffered because their recruiters have found something which went against them. And something very important, that Facebook's privacy settings we should all make use of, so that only my friends and those I tag are able to access my Facebook profile and not others. So if we get into guidelines, the IMA code of conduct again says that we should refrain from being friends to our patients on social media. Just to troubleshoot, we should always Google ourselves and see what comes up. If there's anything which looks troublesome, then please remove that from your social media profile and have get into the privacy settings, check your privacy settings, see your photos or videos, make sure you're not getting into any group which is sexist or racist. And like the last point is most important, you browse through everything, see that what you put across is an accurate reflection of the person you are, the values that you hold. And doctor patient platforms likewise, make sure that because there are a lot of doctor patient platforms available, we may use them to enhance our interaction with our patients. More often the corporate sector in India is using these, but now even we are having to use this is the call of the times. We should make sure again that we use a certain decorum. Dr. Devi Shetty had said long before even COVID came, that virtual medicine is coming, but and India must stand ready to seize this opportunity. For example, now we know this was from before COVID. Now in COVID times, we all know that our patients have connected with us on social media platforms and how simple it has become for them. That because if my patient wants to consult me, all he needs to do is have a video chatting platform, on Wi-Fi, and he can talk to me. He can send to me his symptoms, his reports, and I get back to him in real time. So connectivity and modern medicine are uh, you know inseparable, but and it is advantageous. It gives us a lot of convenience. It saves the patient a lot of commuting time, and it saves me the hassle also of increasing my offline crowd in my OPD. And you can discharge patients earlier because doctors can continue to monitor them when they are in their homes. However, the Medical Council of India has come out with regulations, especially in COVID times. This is something I want to talk about for a couple of seconds. I am not getting into the entire thing because it's a huge document with which everybody can read online. So last year in March, on 25th March, they came out with a 48-page document which has discussion on the professional conduct, etiquette, and ethics of medical professionals, which has been prepared in partnership with Niti Aayog, which talks about telemedicine as an enabler of healthcare access because it increases timely access to appropriate interventions, including faster access, access to services which are not available otherwise, especially during the COVID times. So telemedicine, which is the, I would say, the need of the times and the future of medicine now, means delivery of healthcare services where distance is a critical factor by all healthcare professionals using information and communication technologies available to us for diagnosis, treatment, and prevention of disease, injuries, research, evaluation, and continuing education. This basically encompasses all that I've talked about, and the tools can be anything. It can be a telephone, it can be a video call, it can be a laptop, it can be an iPad. You could be doing it over WhatsApp, Facebook Messenger, Zoom, GoToMeet, just anything. The possibilities are endless. I think I'll skip this because we don't have the time, I think, because the next session will start. So the carry home messages which I want to talk about, that responsible and professional behavior is still needed when we are talking on social media with our colleagues or our friends or our patients. What goes into cyberspace remains there forever. It cannot be removed and it may spread beyond a person's control. So make sure that the pictures or the data or a video that you're putting over there has everything. The conduct is totally professional. A moment of rashness, this is about our younger colleagues and for medical students. A moment of rashness now could have unintended or harmful consequences in the future, and inappropriate online activities can be detrimental to relationship with patients and colleagues, training and employment prospects, and even personal integrity. Doctors must have a questioning and curious mindset, be able to pick up knowledge which is available online from webinars, from journals, etc. But all that glitters is not gold, and we need to still sift that knowledge repeatedly by reading from other more reputed textbooks and platforms. And because as doctors we always speak from a position of authority, so we should constantly upgrade our knowledge, and medical professionals cannot and should not avoid using social media because their use will be personally and professionally beneficial, but disappearing behind a user name should not give us an excuse to abuse the privilege that we have as medical people, and we must still uh, behave with decorum. So traditional expectations will still apply in this very non-traditional context. We know that telemedicine or video calls and connections with our patients and peers is here to stay. However, like I said, the traditional expectations will still apply even when we are talking about medicine and communication over social media. So telemedicine will become the core methodology of healthcare delivery in future. That is where we are going to get the efficiency we need to provide affordable care, always very applicable, especially to our country, where a big, huge rural population may not have access to quality healthcare except through telemedicine. Thank you.